Thanks, Karyn. You can go ahead.
Okay, hi everybody. Like Lisa said, my name is Karyn. I'm a physical therapist with Rush Physical Therapy at our Mount Prospect Clinic. And I am what is under our program, a ReVital trained physical therapist in cancer rehab. I'm also a lymphedema therapist. And so I will be on this call. Adriana is definitely our pelvic floor specialist. So she's going to take the lead on most of this. As you can see at the bottom, there's just another designation, but Corvia is the name of our public health program. So that's why you see those two different differentiations, but we're both from Rush Physical Therapy. So at the end, I can go ahead and answer any questions you might have more specifically towards the cancer rehab aspect. But Adriana is absolutely our pelvic floor specialist. So we'll let her take the lead on any of those other questions. So handing it off to you, Adriana.
Hey, thanks, Karen. All right, so I don't have to introduce you now. But so my name is Adriana Schoenfeldt, and as Karen said, I'm a pelvic floor physical therapist at Rush. I work with Karen at Mount Prospect, but I also work out of our Palatine location as well. Um, and so I'm happy to be invited today to speak on sexual function and the pelvic floor for cancer survivors. As you may know, so cancer is a journey, and we recognize it's not everyone's path is the same. Everyone starts in a different place based on your age, beliefs, support system, general health and well-being, among other factors that contribute to where you are at the beginning. Also, your destination may be different. So is your destination finishing treatment and putting cancer behind you? Or is it living with a chronic condition and managing side effects to lead as normal and independent of a life as possible? So your destination is determined by the goals set between you and your medical team. And once diagnosed with cancer, your path may take you through different treatment choices, such as surgery, chemotherapy, targeted therapy, radiation treatment, and those are all customized by your care team to meet your needs and get you to where you want to be. And so with specialized treatment, each person's side effects and intensity of side effects will vary as well. And the tolerance to treatment will be impacted by your general well-being and where you started diagnosis. So while sexual health is a component of overall health and is important, it's less often discussed. So some of my goals for today are for you all to walk away with understanding the role that the pelvic floor plays in sexual function, as well as feeling more comfortable and confident discussing sex as it pertains to the cancer experience. And so as we go through this today, it's important to recognize that some of this information will feel different to each of you, and there are no expectations of how you should or shouldn't be experiencing sexual health. So hopefully this conversation will improve the awareness of changes in sexual health, available support, and how to be a self-advocate for your personal needs. So as the slide says, definition of sexuality refers to how people express themselves in a sexual way. It includes how they see, feel, and think about themselves as a sexual being and the ways that they show it through their actions, behaviors, and relationships. So those diagnosed with cancer or undergoing treatment face a lot of change, including any physical, emotional, hormonal, psychological, and financial, just to name a few. So if those changes lead to difficulty with how you would like to express yourself sexually, or affects your sexual function, or feeling sexually fulfilled, it may be considered a sexual dysfunction. So the good news is there's a lot of opportunity to improve sexual dysfunction, and the best way to reach your goals is to start that conversation with your medical team if it hasn't already been initiated. So as a pelvic health physical therapist, I do assist patients in reaching their pelvic health and sexual function goals. So for today's presentation, we'll focus more on those physical barriers that may impact sexual health, while also highlighting some other professionals and resources that may assist with other aspects of sexual function. So, specific to the cancer experience, with treatments such as surgery, radiation, chemotherapy, and hormonal therapy, you may feel physically different. So, tissues or sensations may have changed, natural lubrication may be different, and you may have pain or weakness that limits your mobility or comfort with doing things that you previously enjoyed. Additionally, body image, mental health, changes in your routines, levels of support, and overall quality of life can be influenced how you feel about your sexuality. So from that physical perspective, the pelvic floor muscles, they have a significant role in sexual function. So to help explain pelvic floor involvement a little bit more, I just wanted to give a basic overview of some pelvic anatomy. On the left side, we have a cross-sectional view of the female pelvis, on the right side of the male pelvis. So I mean, if we cut the body like right down the middle, this is what we see. So at the very front on both models, you have your pubic bone at the very front, and right behind that is the bladder that stores urine and leads to the urethra. Right behind that for females, we have the uterus that extends down to the vagina. And then at the very posterior aspect of things, kind of closer to the tailbone, we have the rectum. And so underneath all those organs, you have your pelvic floor muscles that kind of act as a hammock or a sling, as if you will, that helps support those organs. So this is just a little bit more detailed look at some of those muscles. Again, we have female model on the left and then the male on the right. So in addition to supporting those pelvic organs, the pelvic floor muscles also assist with closure, so making sure we don't have any urinary or bowel leakages. They also assist with relaxation, so letting us go to the bathroom when we want to. The muscles have a big role in sexual function, which we'll talk about more today. And then pelvic floor also makes up the foundation of your core. So pelvic floor makes up the bottom, and then you have your diaphragm that sits underneath your rib cage that makes up the top. And then you have your abdominal and lumbar muscles that make up the rest of your core. And so all four of those muscle groups need to be working together in order to function appropriately. And sometimes if these muscles aren't doing their job well or they're carrying unnecessary tension, they can contribute to challenges with bowel and bladder function, pain in the pelvic region, as well as sexual dysfunction. Okay, so everyone's path through treatment is unique, as well as sexual health. So the more clarity that you have on sexual expectations and safety along the road will help make sure that you're not making assumptions and that you can make informed decisions in confidence about what's best for you. So, for example, if you're at the start of treatment, you might be wondering about, or some things that would be helpful to ask about are any fertility treatments or childbearing options in order to plan ahead of treatment. And then, after any treatment, making sure that if you're not satisfied with your current sexual function as your new normal, that you are able to discuss with your medical providers on the options and resources that you have moving forward. So things that are involved with that may include changes in libido or arousal. These are very common concerns that we see. And there's a lot of variables that can contribute to this. So for example, from a physical standpoint, I often see patients who have a low libido that's heavily influenced by pain. So if you have pain or fear of pain with any movement or activities associated with sexual health, it would make sense if your desire for sexual activity would be affected. So trying to address those underlying causes of pain and working on healing any tissue issues that are involved would be essential in helping you reach your goals. And changes in arousal or libido could be from a variety of things, such as any physical or hormonal or psychosocial factors, just to name a few. And it's important to know that changes in sexual desire are common and not something you should be afraid of to discuss with your medical team and your partner if you have one. And a sex therapist is also a very excellent resource to help address any libido, intimacy, or sexual health goals as well. So what does a physical or occupational therapist have to do with sex? So with cancer rehabilitation, those therapists, their primary goal is to restore function and quality of life, and your ability to perform activities of daily living. And sex is considered an activity of daily living. So discussing your concerns with your PT or OT can help them determine how they can assist, whether it's positional modifications for comfort, or improving activity tolerance, reducing fatigue, or referring you to another specialist, such as a pelvic floor physical therapist. So just as you would talk with your therapist about logistics or strategies for being able to return to work or pick up your grandchildren or exercise safely throughout treatment, you can and should discuss any functional requirements and goals that you might have related to your sexual health preferences as well. So for pelvic floor physical therapy, just as a doctor can specialize in pelvic health for women and men, physical and occupational therapists can also specialize in pelvic floor muscles. So these providers, such as myself, we regularly perform vaginal and rectal assessments and treatments to target both internal and external pelvic floor musculature and how they relate to your symptoms. So pelvic health therapists are great resources for specifically for survivors who might be experiencing pelvic pain, whether it's related to hormonal changes or treatment or post-surgical radiation, pain, or any other causes there. For those who have pain or tightness with physical touch or activity on the outside or inside of the vagina, anus, or rectum. Can also be helpful for those who have changes in their ability to achieve or maintain an erection, as well as those who might have difficulty controlling any bowel or bladder function. Some initial examples of things that you might expect to accomplish with pelvic floor physical therapy might include learning positional modifications in order to make sexual activity more comfortable. We talk a lot about pain management strategies, as well as breathing and relaxation exercises. We can also work on strategies for gradual progression towards sexual function goals. For instance, just working with your therapist to help break down certain activities that you want to resume, maybe into smaller pieces at a time, so that you can work on regaining some comfort and confidence with those different aspects until you're ready to put them all together, if that's something you want. Additionally, we do work on pelvic floor exercises, not just Kegels, if you've heard of those, but it's a lot of core and hip and spine strengthening and mobility work, as well as both external and internal hands-on treatment, as I mentioned before, only performed with your consent, of course, and if you feel comfortable with this as part of your treatment plan. We also address a lot of urinary and bowel concerns because a lot of the times those can be related to sexual dysfunction. And additionally, a lot of patients who might have some of these bowel and bladder dysfunctions, whether it's incontinence or frequency or something else, these types of symptoms might be impacting your interest in participating in sexual activity. For example, if you're afraid of having leakages during those moments, then that's something that we can address in order to make you feel more comfortable with intimacy. And then additionally, we work on establishing a home exercise program for you to complete independently or work with your partner if that's part of your goal. And then we can also assist with establishing referrals to other specialists who might be helpful if we feel that there are some things that might be out of the scope of physical therapy. So not only can pelvic floor PTs treat any tissue dysfunctions that might be associated with your limitations, but we can also provide you with some advice regarding lubrications or equipment available to help improve your experience and function. So for example, dilators, pelvic wands, other adaptive devices such as an O-nut, if you've heard of those, we can help you make sure that you know all of your options and resources to help design a home exercise program to help you meet your goals. So a couple examples on the slide here of some of those devices. The one on the left is called an O-nut, and that can be helpful for limiting the depth of penetration if someone's having pain with deeper penetration. Whereas on the right-hand side, we have dilators, and those can be helpful for reducing pain, also with either vaginal or rectal penetration. So overall, using these tools to help improve some tissue mobility or reduce sensitivity, or just even getting comfortable with touch on your own. Okay, so the more that we talk about how function can relate to sexual health, and the more awareness we can draw a lot of relationship between the two. I just wanted to give a few examples of ways that cancer rehabilitation may support your sexual health goals other than just pelvic floor specific needs. So on this slide, these are just some additional ways we can assist with your goals. So for instance, if you're experiencing pain that might be limiting your ability to participate in any of your preferred intimate behaviors, that's something we can help out with. So for example, if you're having shoulder pain after surgery and you're unable to hug your partner, that's important and that's something we can work on. Or let's say you're unable to reach a hands and knees position that might be your preferred sexual position. Maybe that's due to pain that's limiting you from getting into that position, or it's shoulder weakness, or just cancer-related fatigue. These are just some examples of how pain and weakness might be limiting what you feel up to with participating in. Additionally, it's not uncommon to have sensitivity near surgical scars or areas treated with radiation therapy. And so therapists can teach you how to reduce some of that sensitivity and make you feel more comfortable with touch to this area. For instance, if after breast cancer, if you have sensitivity with skin-to-skin contact of the chest wall, a therapist could help you with that. And then lastly on this list here, there's so many benefits of physical activity and exercise in general, but many people don't know how to get started safely with those. So a cancer rehab therapist could help design an exercise program that's safe and specific to you so that you can still experience some of those benefits of exercise. So no matter what your diagnosis is, each patient's needs are unique to their level of function before diagnosis, specific diagnosis and treatments required, and everyone's goals. So you may not have sexual health goals right now, and that is okay. But we want you to know that if and when you do, it's important that you know that there is support out there and how to find it if you need it. So some of these other support systems outside of PT and OT would include sex therapists, mental health providers such as counselors, therapists, or psychologists, your entire medical team, and also specialized sexual medicine providers. So I know that was a lot of information regarding sexual health and physical therapy. So I anticipate people to have some questions. So right now, while it's still fresh, I just encourage you to either write on your phone or piece of paper any questions you might have for either Karyn or I in a couple minutes here, or just anything you want to ask your medical providers at a later time. So just to quickly summarize some of these things we talked about. So sexual health may be impacted by your cancer experience and is something that you should feel comfortable discussing with your care team and partner. There are specialists in both rehab, mental health, and medical landscapes equipped to help you work towards your sexual health goals. So don't forget about us pelvic floor physical therapists who are specifically trained to help with any pelvic floor specific needs. And if this feels a little uncomfortable to you at first, it might also be helpful just to practice verbalizing your concerns and needs to both your care team or your partners. So I just want to say thank you very much for your time today. I hope this helps people feel seen and empowered as you navigate through sex and cancer, and that you know how to get the support you need, should you need it and when you need it. So thank you.
Thank you, Adriana.